Hello viewers, thank you so much for joining this live session. A lot of people were asking me, sir, how to join Army Dental Corps. First of all, I would like to introduce myself. I am Major Dr Pravin and I have served the Indian Army from the year 2000 to 2009 and I am a BDS graduate. I am not an MDS. So after the college I passed out in 2009 and after I passed I got immediately selected and I had a temporary set the medical, so I had ear wax, so for which my selection got delayed by almost 10 months and I got my call letter sometime in September 2004. So on September 2004 I joined the armed forces as a dental officer in 331 Field Hospital, which was in Uttar Pradesh. Then I moved to various places. So for the benefit of the viewers, people have a lot of questions about how to join army. And first of all, before I would like to share the details to join the army, I want to tell you what is Army Dental Corps is all about. On Army Dental Corps is consist of actually dental officers who serve the Indian Army soldiers and officers and their families who are actually fighting. In Indian Army, we have two categories of people. One is the fighting arm and the other is service arm. What is fighting arm? Infantry, artillery, armored corps, air defense, and all that comes under fighting arms, those who actually really fight with the enemy. So during the fight with any enemy, we will have casualties. People will get wounded, get injured, some people will die. So, and the people who are working there during the fight, they need support systems, they need telecommunication, they need food, they need to go from one place to the other. So we have a big chunk of services who supports the actual fighting arms. Like for example, if infantry is fighting, if there is a particular soldier gets wounded, the battle nursing assistant, the BFNA, the battlefield nursing assistant, will carry him and he will put him in a place called ADS, advanced dressing station. And from advanced dressing station, he'll be moved to some place called forward surgical center. From forward surgical center, he'll be referred to a field hospital. From the field hospital, he'll be referred to a core hospital or a military hospital. From there, he'll go to a command hospital or R&R center in Delhi. So this is the way of patients flow. Likewise, if you see a army soldier or anyone gets wounded, he needs a nursing assistant, he needs medical people, he needs dental people. What is the role of a dental surgeon in the Indian Army? We have two types of roles, wartime role and peacetime role. Peacetime role, we do all dental duties. During wartime, we have military duties, like helping the medical setup to establish the centers, the center for wounded people and things like that. So these are the main criteria. So a lot of people ask me, sir, do we really fight with the enemy? I always tell yes. In Indian Army, if you wear a uniform, the moment you wear a uniform, you are supposed to do every military duty, whether it is fighting, it is like defending your mother, okay, mother country. So you need to be, you need to do all kind of military activity. So what I would like to tell you is, you have to be strong. That is why they require physical strength and they require mental strength. If you are mentally strong and physically strong, you can win the war, right? Because any battle requires these two things, mental stamina and physical stamina. Because even if you have mental stamina, physical stamina also is important. That is why army has got medical, army, air force, navy, everything has got medical, very strict. First of all, the organizational structure is, Indian Army falls under Director General Dental Services, DGDS, and he is the control, he is the top man or the top boss of the organization. And they have the board which selects army dentist, civilian dentists are being recruited and they are trained, made like an army dentist, and they are then disposed to various units of Indian Army. So we have various Indian Army units everywhere in India, in other parts of the world also. So everywhere, around 10,000 people will be there in a particular place, there will be a dental officer who takes care of. This is the ratio. So the calculation is more MBBS seats will be available in Army Corps. There is an Army Dental Corps, the amount of dentist placement itself is very less. So there are not going to be many dentists who are going to be get selected. That is why if you see, the number of seats will be as per from the service. Like I was released from the army after my short service in 2009. So once I go, there will be a vacancy. So they will move somebody there and somebody will be recruited. So sometimes new units will be started by the Indian Army. New fighting units need some dental services, they will recruit. So we cannot say when the vacancy comes, how much comes. Everything is calculated in the top organization. So I would like to tell you, this is the overall nature of duty for an army officer. So how your life will be in army. So after you join army, there won't be any difference whether you are a dentist or whether you are a medical doctor or whether you are a person. Everything is calculated by rank. Then you will be promoted as a major from its time scale. It means after promoted to the next level. 6 years to till 11 years you will be a full colonel, who will have a red tab here, and after that there will be boards conducted. You will become a brigadier, then you will become a major general. Then if you become a lieutenant general, you will become there will be only one lieutenant general who will be the director general dental services. I hope now maybe new changes have come over the years of army. Since I left army many years back, 2009 I passed out. So I came out. So there will be changes which I cannot say right now in this video. So for selection, so once you get into the army, so you will be posted along with medical people, and you will be posted in field hospitals, and you will be posted in military hospitals. In military hospital, we have a section called military dental centers. We after that next level will become core dental centers. There will be core units. You won't understand what is core. Basically, these are all bigger, higher formations who are protecting the Indian country, Indian country. So after that, we have commands who are controlling the whole Indian army scenario. So everywhere there are hospitals, and everywhere there will be doctors. So based on their rank, based on their experience, they will be posted. And young officers, like who are, if you suppose you are getting selected, maybe say in the month of September, you will be posted to MOBC, Medical Officers Basic Course in Lucknow. There you will be taught everything, how to be physically fit, march past, salute, everything. There will be some people who will be already joining and going to the medical officers training later, and you will be able to learn all the military things. You will be taught military law. Then you will be taught, basically in the morning you will have drills and disciplines. In the afternoon times you will have classes, and you will be, because army is a big organization and you have to understand how the organization runs, because as a dentist you cannot understand. So they will convert you into a military man by this training. So if you get good marks, this will be counted in your future ranking, promotion, everything. So after that you have to serve the field service. Field service will be either the Jammu Kashmir area or will be in the northeast area. Okay. Why we have to serve there? Indian army is for fighting and defending the country. Indian army is not there to make you a dentist or make you a postgraduate specialist. These are all privileges and perks Indian army is giving you. It's not something you are going to aim for. That is the mistake many people are doing. They go to the Indian army with the thinking that what is my benefit. See, the organization thinks about its benefit. Indian army is there for India. So they will think of their thing. That is right. India is to be protected. We are before the country of India, we are nobody, right? So India is to be protected. So India needs soldiers and officers. So that is why Indian army is selecting people for various posts. But if you think you are going for PG, you are going for some salary, then your life will be miserable. You know why? Because a lot of people they go with the notion like this, and they get to see the difficulties of the subject. Because when I went, I was very happy, because I am a very positive person. I take things positively. I don't feel bad to eat chapati. People say I'm a Tamilian. They call us Tambi. All Mallus, Malayalis, Tamilians, Kannadigas, and Telugu people are mostly called as Tambis because Tambi means this southern part of Indian belt is called Tambis by the senior Indian officers. So that is a tradition. Army is a very traditional organization. You have lot of traditions, lot of things, but it's such a wonderful organization. If you get an opportunity, please go and join. Never miss it, at least for a short service. Why I got out of army short service is because my personal motive is to be a dentist only primarily, and my wife is a software engineer. So I don't find enough happiness there because I need to come out and start my own venture. Now I am very successful because everything is going for good. So it's my personal reason. It's not like army is bad because I like to do more of dentistry. So I came out of army and I started my own businesses and practices, and I have my academies. So coming back to a recruitment thing, there are a lot of details which is there in the Indian Army website. So basically, to join the army, I've given you the lifestyle, I've given you the ideas, like overall picture. So right now, if you like to know more exact criterias, there are many videos already there. I checked in the YouTube, but these are the points which are not there since I served the army, and I want to give some insights to youngsters. Okay, first of all, Indian Army is not selecting your degree, is selecting you as a person. So you should understand that the person is more important for army, not your degree, not your marks. So even if you get the number 1 NEET mark and you go to army, you might get rejected because if you don't have the right personality. So now here comes the question, what is the personality I'm supposed to carry? Indian Army, they say they don't need Einsteins or they don't need Socrates. They need common sense people, people who can adapt, people who can easily, like I'm a Tamilian, I was telling, I can eat chapati, I can be happy with the being in a place where I don't speak Tamil. I can be without Sun TV, or those days I like to watch Sun TV and all that things. There was no opportunity for me because my officers will be watching, Hindi channel. I have to learn to enjoy. They say when you go to Rome, you have to be a Roman, right? So it's like that. So my point to all of you is, if you have that ability to adapt, in the interview they will be able to identify your personality, because army is very well trained in understanding the minds of the people they are connecting with. Even terrorists, even anybody they interact, they will understand the mindset first. So they will know the motive behind the person. So Indian Army is very good in that. You know, SSB and other SSC selections, everything, defense selections is something great. I'm telling you, it's one of the most toughest job. So they need the tough people, the tough minds who can adapt. So during the interview, they will see your body language, the way you are sitting, the way you are dressed up. Go with full formals, go with ties. Women should go in nice formal dress and carry your posture very nicely, sit nicely and be confident, be cool, don't be overconfident, express nice confident posture, talk clearly, talk slowly, look at the eye. These are the small petty things which any interview, but army looks even the most basic stuff. So you don't have to be something like very fearful. So for your age, right out of the college, you may be fearful. I'm not telling like all the time you have to be like an army officer to sit in front of another actual army officer. Go be yourself, but learn to be confident. That's all I want to say. So because they already you are already selected through NEET, so they know you know the subject. They are not supposed to still they will ask you like how about various questions, like there will be various specialists. Indian Army has got every specialist. There will be psychologists will be there. They won't say who is sitting in the board. So we don't know the framework of the board. We don't have to, because we have to know about ourselves only. We don't know who is asking questions. That is none of our business, right? So carry confidence, have good posture, and be very understanding. The second thing is, the same day they will tell you, okay, we have shortlisted, these are the people, and I still remember 6 names they read out out of some 100 people that day, and my name was there. And next day you will be sent to the medical center, army medical center, maybe R&R, I don't know where they will send. There will be army medical establishments where you will be sent, and you will be told how to fill up the forms. There will be a lot of paperwork, and you will be checked everything from head to toe. They will check you Even they have to strip you also, they will strip you and check everything, whether you have hydrocele, hernia, everything they will check, physical check, surgical specialists will check everything, they will palpate. For women also there are special women medical officers who check everything, they do medical examination, everything they will ask, whether you are pregnant or whether, everything they will ask, any question they will ask you. Okay, so simple things I want to tell. Ear wax, please clear the ear wax. And there are permanent deformities, there are temporary deformities. Ear wax is temporary, they will give you a time frame to go and correct it. After 40 days report to any command hospital, and again your paper will be going to the army headquarters. So you temporarily they won't select you, but after a couple of days they will call you back once you clear the temporary unfit. They call it a temporary unfit. So this will be a little tough, like flat foot they won't select, knocked knees. There are a lot of medical criterias. That itself a different video. One day I will try to put a different video about dental points and all that. I hope that a lot of things are there in YouTube also, but it's a big subject, right? So let's keep it clear, short here. So you have to clear the medicals, permanent deformities. You may not be selected. They will openly tell you you are rejected. So if you are rejected, don't get dejected. That's all I want to say. God is always having a better opportunity for every person, because God has written all of our fate in the palm of His hand. That's what the Bible says. So I am very staunch believer in that. If you are selected, be happy. If you are not selected, cool. Okay, go and do some clinical dentistry and get yourself better. So after medical, then they will say, chalo, घर में letter आएगा. So what happens now after all this, no, like whatever vacancy is there, how many people have been selected, how many people are medically unfit, how many are fit, there are so many calculations they have to make, and finally at one point of time the call letter will come to you, and the call letter will say, please report to so and so unit, and you have to write a letter to them, a letter called DO letter, and you have to a letter which says that you have to contact them, like it will be like care of 56 APO, 56 Army Post Office, that is the address, or 99 APO. So they might tell you to go to a particular unit, there won't be any address, you have to write a letter to find out the nearest railway station. They will tell you the nearest railway station, so you can book a ticket, and I think now you can book flight also, now you are authorized to go when you join. So Army is a wonderful organization, my dear friends. I'm still feeling my life has changed because of Army. I am so glad that God has given me an opportunity, and you have to clear NEET, and you have to you have to apply in the Army Dental Corps website. Then once you apply, you will be called for an interview, clear the interview, then you have to go for medical, clear the medical, then wait for your call letter, and this is how the selection process is. And any doubt, you can put it in the comment column. I will be addressing all of your comments, and I will make a separate video for medical, and if you want any other topics pertaining to Army, I will clear it. Before that, I have few questions which I saw through the internet, which I am going to address. See, the questions will be like this. Let me give you some questions. How do you get into Army Dental Corps? I tell you, first of all, please don't tell it's corps. Corps is dead body. Army Dental Corps, CORPS is pronounced as corps. Please don't say as corps, and don't say ADC. Just say Army Dental Corps. Okay, what is the work of Army Dental Corps? I have told you. And what is the cutoff for Army Dental Corps? The cutoff is like NEET MDA score is called cutoff. So they will announce salary. Salary will be a lakh and above. You will have a lot of perks, and presently you will be getting a good salary. Don't worry. Salary is fantastic in Army, highest paid. So how to prepare? You don't have to prepare anything specially. As I told you, express confidence. First of all, whatever you are doing for NEET exam, that is more than enough. And so do Army dentists get deployed? Yes, you will be deployed in any part of the world. You will be posted even in abroad countries if you are a permanent officer. Once you get selected in the Army, after 2 years you will be going for your permanent commission. Permanent commission is like a permanent job. So short service is for 5 years, extendable up to 14 years. After 5 years, you have to write and give that you want to continue. So the process is you can go up to for 14, 15 years. Okay, I think 14 years. So I quit after 5 years. One of my friends worked till complete 14 years, and he went to Bangalore. I don't think that is a good ideology, because you will be stuck in the middle. Better to either continue fully or quit. That is my option. So equivalent rank will be given in the Navy also. Like if you are you will be called as a lieutenant there in the Indian Army. Rank in Navy will be equivalent to Indian Army. So there is no BDS in AFMC as far my knowledge is concerned. Only MDS is there. And how to get selected for MDS? We have criterias like those people who have already did Army Dental Corps. If suppose like me, after I came out, within 3 years I can get selected in the MDS for Army, suppose as a civilian candidate. Civilians is those who have not done any service. They also will be given an MDS. People like me, ex-servicemen, they also will be given medical seats. And people from foreign countries, based on the Indian government appointments, people from other like other organizations like BSF and paramilitary forces, they get. So and things like that. So these are some of the questions which I got. So there are many videos in the army this thing, but I think I am the only army ex-army person officer who have given. There are a lot of people who got selected, and they have given information. So it's a beautiful organization, and I wish all of you all the best. If any doubt is there, I'll make future videos. So this is given for based on the request I'm getting. It's been my long dream to give a video about army, so I thought I'll give a live so that many of you will be benefited. And thank you, dear friends. Jai Hind, and God bless you. Jai Hind. Jai Hind. Hats off to all of you. Thank you. Off பண்ணிடு.